Hello, everybody, and thank you for joining us for this webinar on how assessment centers can promote youth diversion and public safety. I'm Josh Weber. I oversee the Youth and Juvenile Justice Program at the Council of State Governments Justice Center, and I'm grateful to be joined by Carly Keeter from the National Assessment Center and Corey Shreve from the Ohio Department of Youth Services. The webinar today is going to be divided into a couple of parts. First, I'm going to start by providing an overview of the current state of the field in terms of juvenile justice and the importance of focusing on diversion and early intervention. Carly will then talk about the role that assessment centers can play in helping jurisdictions to improve and better coordinate early intervention and diversion services for youth and families with service needs. And then Corey's going to talk about the work that Ohio is doing around assessment centers. Ohio actually has the most assessment centers of any state in the country. If you're not familiar with the Council of State Governments Justice Center, we're a national nonprofit, nonpartisan organization. We work across all branches of state government as well as with local government to help improve outcomes for youth and adults in the justice system through evidence-based, consensus-based approaches. In our juvenile justice and our youth-related work, we've worked with the majority of states all across the country to help assess their policies and practices and help them to align what they're doing with what research shows works to reduce recidivism and improve outcomes for youth. And so that also gives us a very good perspective on the opportunities and challenges facing states all across the country. I think it's important to acknowledge and start off any conversation around not just juvenile justice, but adolescents more generally with acknowledging that I've been doing this work for over 25 years, and this is probably the most challenging time I've seen in terms of public concern around youth crime and youth violence, media coverage, political divisiveness that hasn't really been seen since the super predator era of the mid-90s. And so within that political context, it's more important than ever before to really focus on evidence-based strategies for improving public safety and youth outcomes. And it's important to acknowledge that there is a reality behind that concern in many communities around youth violence. Youth violence spiked coming out of the pandemic, as did adult violent crime and particularly homicides. You can see that homicides, arrests for youth homicides have actually been increasing for the past decade and then really spiked coming out of the pandemic. And so as a result, suicide and homicide is now the leading cause of death for older adolescents in the United States, more than car crashes or accidents or any other single cause of death, which is obviously shocking. Much of that violence is peer-to-peer violence, and it disproportionately impacts youth of color, with rate of firearm deaths among Black youth being 20 times higher than white youth. And it's not just an issue in urban communities anymore, also an issue in rural areas. And so any juvenile justice strategy, any focus on adolescents really has to include an evidence-based violence prevention and intervention strategy, because obviously one young person committing a violent offense is one too many. That being said, it's important to place these recent trends in historical context. And the historical context is that overall arrests for youth violent index offenses, which include aggravated assault, robbery, rape, and homicide, have actually declined over 50% from 2000 to 2022. They did see that, surge coming out of the pandemic and in 2023. But then based on the latest FBI report that recently came out, youth violent offenses and the murder rate declined in 2024. And so we have a much longer term trend of youth violence being on the decline, the pandemic hopefully being a once in a generational event that helps shape both youth and adult trends. And so it's important for systems to take that violence seriously, but also not to overreact to short-term changes. And it's also important to place those violent offenses within the larger context of the juvenile justice system. The reality is only about 6% of all arrests that happen for kids every year are for those violent index offenses. And most youth who get involved in the juvenile justice system actually have not caused physical harm to another person, were not arrested for a person offense. So you can see that's about 70% of all kids who are arrested did not commit a person offense. That's over 250,000 young people every year. And then as you go deeper in the system, the proportions don't change that much. 2/3 of kids placed on probation, 2/3 of youth who are incarcerated have not committed a person offense. And we know from a lot of research over the last decade, including more recent research from the Youth Protective Factor study that we were a part of, along with Berkeley University and the University of Massachusetts, that youth who are referred to court who are assessed as low risk generally do not reoffend. And in fact, the Youth Protective Factor study followed kids for over a year and a half post-system supervision and found that youth who were assessed as low risk had a very low rate of reoffending, even though many of them never actually received any system supervision or even any services. And in fact, nationally, and this is one of the more surprising statistics, less than 30% of all youth who are arrested and referred to court are actually adjudicated. Their cases are diverted, their cases are dismissed, they get some sort of informal adjustment or supervision. And the Youth Protective Factor study showed that even if many of those youth are being referred for services, they often don't get services from the juvenile justice system. So it really raises questions about is it an effective use of resources and an effective public safety strategy to be arresting youth, to be putting them through the trauma of that arrest. We know that arrested youth have lower high school graduation rates and that arresting youth can actually increase their recidivism, making families go through the trauma of that process, potentially the time and the cost of court fees, attorneys, judges, when the majority of those youth never actually get adjudicated by the system. And in fact, very likely for kids who have service needs that are not based on their risk to reoffend, they would have more likely received potentially services outside of the juvenile justice system if they were never arrested and referred to the system in the first place. And we know that this particularly impacts youth of color. Despite declines in the number of youth overall who've been arrested over the last decade, racial disparities have gotten worse, particularly for Black youth. So Black youth, 2.5 times more likely to be arrested, almost 3 times more likely to be referred to court, almost 5 times more likely to be detained, and almost 6 times more likely to be placed than their white counterparts. And all of this matters because we have really good research at this point that shows that juvenile justice system involvement for lower risk kids is not an effective public safety strategy. And in fact, the decision to refer youth to court can change the entire course of their lives. This is from the Crossroads study that looked at 2 similar groups of youth. One group was formally processed by the system, the other was diverted, follow them for 5 years later. And the youth who were formally processed were more likely to be arrested and incarcerated, more likely to engage in violence, had lower high school graduation rates, and generally had lower perceptions of their life opportunities. And so really, in terms of a public safety strategy, diversion and keeping youth out of the system if they're low risk is a better strategy, in particular because it also allows for resource investments and a focus for the system on higher risk youth. This is also important because youth are facing increasing needs, and we need to make sure to address those needs. This is data from the CDC from 2023, and what we see is adolescents are experiencing increasing mental health challenges, with a high proportion of high school students reporting that their mental health was not good most of the time, that 40% felt sad or hopeless compared to 26% in 2009. And those numbers are very high for girls and LGBTQ youth, and youth struggling with feelings of self-harm and adolescent substance use and overdosing. And schools have traditionally been a key outlet for identifying and supporting youth with these behavioral health and other needs, but coming out of the pandemic, absenteeism, which is attending school, missing school at least 10% of the school year or more, surged. So you see in the lowest performing school districts, which are often in the poorest communities, more than 1 in 3 young people in 2022, and these numbers have come down a little bit, but not much, were absent from school more than 10% of the time. And finally, jurisdictions are struggling with an unprecedented staffing crisis, both public agencies and service providers, to meet this increased need. We did a national survey, and justice agencies told us that they were facing moderate to severe challenges in hiring and retaining staff. Their service providers were facing similar challenges, and they didn't feel like their state had a plan to address those staffing challenges. And so to help tackle some of these challenges, we launched recently the Collaborating for Youth and Public Safety initiative with 6 states, California, New Mexico, New York, Ohio, Oklahoma, and Rhode Island, to really help states work across systems to address the complex needs of young people without necessarily involving the juvenile justice system. And so one goal of that initiative, based on this research and based on the current state of the field, is to really encourage jurisdictions to develop a jurisdiction-wide early intervention strategy so that youth and families can get services without needing to be involved in the juvenile justice or the child welfare system or with courts or out of home placement more generally. And some of the key components of that is a viable alternative to police contact. Often when youth and families are in crisis or when they just need help, they don't know where to turn, and they often turn to the police, and the police has limited tools to support those needs. And so things like assessment centers, family resource centers, centralized hotlines, 988, other resources can provide a viable alternative to connect youth with necessary services, mobile crisis, and really help support an assessment of their needs so that they can get help before they penetrate further into the system. We also have increasing evidence that peer supports, credible messengers, family navigators can be an effective tool at the front end of the system to help youth and families navigate and connect to appropriate services and supports so they don't become involved in the system. The importance of crisis respite and shelter so that if there is a crisis, rather than youth having to be arrested for domestic issues, that they can go someplace, get services, there can be family mediation, and that more generally there are opportunities to connect youth and families to a network of services that don't require eligibility of system involvement and that can also engage youth in restorative justice activities. And so some of what we've learned from our initial experience with the Collaborating for Youth and Public Safety initiative is, unsurprisingly, that multi-system collaboration is really needed to address these concerns and to develop a more seamless, centralized early intervention system, but it's also incredibly challenging. But that there are opportunities. There's a lot of good things happening on the ground in states across the country, but those efforts are often siloed and not necessarily connected with each other. And so there's an opportunity for jurisdictions to think on the juvenile justice side about diversion initiatives and alternative responder initiatives. On the behavioral health side, Medicaid-funded programs like mobile crisis, certified community behavioral health clinics, intensive in-home, wraparound, peer supports. On the child welfare side, Family First funding can be used for evidence-based, community-based family therapy programs and respite and shelter. Schools have their own diversion programs, and given the absenteeism challenges, are investing more in truancy reduction supports. And there's also a growing movement around grassroots mentoring, credible messengers, violence interrupters, and services. And so really, if we want to create a much more cohesive early intervention system, it's taking a lot of this good work that's happening and jurisdictions establishing multi-system tables with different partners, service providers, grassroots folks at the table to talk through how to better coordinate, better braid, and leverage existing funding, especially as resources are becoming more challenging and create a much more seamless service system and early intervention process for youth and families. So I will now turn things over to Carly, who will talk more specifically about the assessment center model and what some of those best practices are.
Thank you so much, Josh. Good afternoon, good morning, everyone. I look forward to talking with you today about assessment centers. So the NAC, or the National Assessment Center Association, really, it's a membership organization that works to support communities that are exploring, designing, or operating and sustaining assessment centers. Our mission is really to strengthen community capacity to connect youth and families to the right supports early, reducing unnecessary systems contact and involvement, and really improving access to services that promote stability in the family, well-being, and reducing risk. We really work in 5 primary areas. The first is around practice standards, where we offer kind of guidance to the field around what it looks like to operate an assessment center through our framework. We offer a self-assessment tool, something that we call ACORN, which is Assessment Center Outcome and Reporting Network, which is really around shared data measurement to make sure that assessment centers are operating as intended. We facilitate peer-to-peer networking and learning, for example, through our annual symposium, so sites can learn from one another, provide technical assistance, whether it's individualized to a community or through practice networks and learning communities that bring assessment centers together. Training and resources, for example, we have a resource library that's available to all of our members, and communities that are, again, either exploring or planning or operating assessment centers. The resource library is full of pretty much anything and everything that you would need to operate an assessment center. For example, job descriptions and, kind of guidance around policies and procedures and things like that. And then, of course, working with our federal and state partners, like in Ohio, to support environments that really support the ability for assessment centers in communities to function in alignment with best practice. So helping communities kind of create coordinated pathways that keep youth or allow youth and families to access services earlier and more efficiently. So I'm going to use the term assessment center, but I really want to focus in on this idea that assessment center is just the original kind of name of what these centers are, but they go by many different names. So in many communities, they're resource centers or diversion centers. And in other communities, they have unique names that are chosen by the community, such as the Harbor in Las Vegas, Nevada, or the Front Porch in Savannah, Georgia, or the Bridge in Ada County, Ohio. While the names are different, the core function of an assessment center really is consistent across all communities. So assessment centers serve as a coordinated entry point when there's a concern that emerges about a young person. The focus is really to understand what's going on in a young person's life, including potentially unmet basic needs, other stressors, behavioral health needs, school challenges, family strain, and to help that young person and their family access support before the situation escalates. This approach really reflects what we know. It's very much in alignment with what Josh was talking about earlier, that early developmentally appropriate access to support tends to lead to better outcomes for youth and reduces the likelihood of escalation into systems involvement. I know this is a busy slide, but it's really kind of highlighting how assessment centers function as a centralized access point for referrals across a number of different domains. This structure of serving as a single point of contact really is intended to address common system challenges. Families really struggle to kind of work through the maze of services. Different sectors may have different thresholds for action. And so centers can be situated in this idea of kind of creating preventionary single points of contact, diversionary single points of contact, or can also serve as an early intervention for young people who may continue through the system, but who also require additional services and supports. So each community really determines the referral criteria and pathways based on the need in the community, the system structures in the community, but the goal is consistent. How do you create alternatives to deeper system processing when it's appropriate? Assessment centers can be appointment-based, they can be walk-in, they can serve a drop-off function for law enforcement, they can be bricks and mortar, centralized, co-located, mobile. They can have set hours of operation, they can be 24/7, 365. But through policy, and I really want to emphasize that, through policy, assessment centers create a single point of contact for either prevention, diversion, or early intervention for youth and their families. Once a young person, the youth and their families are referred to an assessment center through that single point of contact, or through that referral pathway, they participate in a really structured intake process that focuses on understanding needs and strengths. So key areas include identifying basic needs, behavioral health needs, trauma and stressors, community safety needs, potential exploitation or other high-risk situations. Staff are trained in approaches like motivational interviewing, trauma-responsive engagement, adolescent development, and these skills really help facilitate rapport building, help gather accurate information, and build the foundation for shared decision-making with youth and families so that youth and families can then be connected to those resources in the community. The goal here is not just to identify the needs, it's also to help families navigate the services and to stay connected long enough to be able to benefit from those services. So after the screening and assessment process, assessment centers stay engaged. They stay connected to the youth and families. Staff help families follow through on referrals. They manage barriers like wait lists and transportation, which we all know are significant challenges for families, and can pivot when a service isn't the right fit or when some of those barriers are going to really kind of create long-term challenges for the families. So this ongoing involvement improves follow-through and increases the likelihood that youth receive timely and effective supports. Assessment centers are not service providers. Neutrality is an essential feature of the assessment center model. They function as a community coordination point for both families and for systems. So if we think about assessment centers serving as a hub, they are serving as that hub not only to help families really navigate the complex services and resources that are in the community, but also helping services kind of coordinate and work to support youth and families in this very neutral model. So this really helps to build trust with families, but it also positions assessment centers as a connector and a facilitator across youth serving systems. So because youth or assessment centers really assist youth coming from multiple entry points and serve as this single point of contact, this hub, they serve, they're really working to identify needs across a whole bunch of domains. They're able to identify patterns in needs and also able to really kind of keep a handle on what the local service capacity is, information that can help communities understand what's working, where resources are limited or non-existent, and where collaboration could be strengthened, or where there's really a need to kind of focus some attention on building local resource capacity. So especially for communities that are in the exploratory or the early planning phases of an assessment center, although this is also important for assessment centers that might be thinking about expanding into another domain. For example, if they've been working in the diversion domain and are interested in really thinking about how to move upstream and serve more of a preventionary function in the community. We really help or encourage assessment centers and communities to take this first step of mapping how youth are currently moving through decision points from initial concern all the way through each of the decision points where there's an opportunity or an interest in thinking about doing something different. This process helps communities answer questions like where are concerns being identified, who's making decisions, what information informs decision-making at each of those points, what opportunities currently exist and for whom, and what, how are youth really kind of engaging in decision-making? How are they connecting to resources that exist in the community? This process can really help identify where there are opportunities, and for whom. So helping communities identify that target population, how an assessment center can serve this diversionary or preventionary function, and can help kind of support further development. This process is really important because it ensures that all partners are really working from a shared understanding. If we think about an assessment center, again, as that hub, that is a very collaborative approach. So mapping really ensures that the community partners are working from a shared understanding of how the current system functions and developing consensus on how they want the system to function. So this is not about siloed decision-making, but really a collaborative approach. So it facilitates a better understanding, facilitates that consensus building, and helps to increase communication across systems, and identify opportunities for earlier and more coordinated support. The next two slides kind of highlight something that is important in this mapping process, to think about how to create this intervention, an assessment center, that is reflective not only of how the systems currently operate, but what the current processes are like, how they are experienced by youth and families. So that entire process is really informed not only by administrative data from community, from law enforcement, from detention, from schools, courts, child welfare, to really look at how are decisions being made at each of the decision points within these systems. But also, also thinking about how are impacted youth and families perceiving these processes. What is the experience like for them within schools, for law enforcement officers, for those who work in the courts or in the community? What is their perception of, and what are kind of their constraints around decision making? What do they see as some of the needs? So there's also this really important qualitative component, not only of system stakeholders and community stakeholders more broadly, but very much grounding this work in the experiences of impacted youth and families. So once a community has a kind of shared understanding of how current processes are working and is able to identify for whom and where there's an opportunity for prevention, for diversion, for early intervention, the focus then really turns to, well, what are we then going to connect youth and families to? What are the assets that exist within the community? So this other process really looks not only at pathways into the center, but what's the resource landscape? Systems will traditionally rely on a small set of providers. Assessment centers take a much broader view, considering the full range of community assets supports, both formal and informal. So asset mapping looks at what services exist, who's eligible, how do youth access them, and then really looking at whether the capacity meets the demand. This work can help communities make appropriate referrals based on availability, avoid duplication, identify underused resources, and also look beyond just what are the kind of services and resources that might support a particular need, but where is there also opportunity to leverage and kind of build youth and family strengths. Communities throughout this process very often learn that they actually have more assets than are expected. But there are reasons that those assets are typically not included in the more traditional kind of service array. These can be resources, services, assets that are, potentially much smaller. They do not have formal connections to, the more traditional systems. They're maybe not always connected or easy to access for one reason or another. Assets mapping can help strengthen coordination while also really highlighting where new resources or partnerships may be needed. So when we talk about those, maybe more informal or of broader array of community assets that are included in this process, you can see the list on the right-hand side. We're of course talking about behavioral health services, maybe other healthcare services. We are also talking about risk reduction and violence reduction programs, but we're also talking about life skills, mentorship, housing, kind of recreational programs, job placement programs, educational assistance. I mean, this is like the full array of services that are available to youth and families through the assessment center process. For each of those programs, as I mentioned earlier, we're looking at, for those assets, what's the eligibility? What are the referral steps? What's the capacity? To ensure that referrals are realistic and that youth and their families aren't really sent somewhere to remain on a wait list, where there's a much greater likelihood of them disengaging from the process. So importantly, this includes services, again, that are not aimed only at risk reduction and addressing need, but also those aimed at building strength and kind of connecting youth and families to communities. So for a community that is maybe interested or kind of at the, interested in exploring this a little bit more, or starting to really look at the assessment center model, some very kind of typical early steps in the process would really include asking questions around what are the challenges we're trying to address right now. So clarifying what are the behaviors, the system bottlenecks, or other challenges that you hope to address through any number of initiatives, potentially through the development of an assessment center. Who's currently falling through the cracks or receiving inconsistent responses? What resources already exist? And what are opportunities for making those resources more accessible, for connecting youth and families in a more clear and kind of quicker and more supported way? Effective implementation of an assessment center is really built on that kind of collaborative approach where there's a shared vision, there are clear pathways that are very much codified, they're formal through policy change, and there's a coordinated responsibility across schools, law enforcement, courts, child welfare, and community partners to work with the assessment center as this hub for supporting youth and families. Finally, assessment centers translate that coordination into kind of real day-to-day practice. So really thinking about how can an assessment center strengthen prevention and diversion through collaboration. Again, through this idea of clarifying referral criteria, eligibility, capacity, and service gaps through an intervention mapping and assets mapping process. And with that, I'll turn it over to Corey to talk about the work that they've been engaged in Ohio.
Hello, everyone. Glad to be here with you all this afternoon. Josh, Carly, thank you very much for those awesome presentations. I know we have a lot of Ohio folks out there on the call today. First, I just want to say thank you to all those sites that are on the call today. This initiative wouldn't be possible without all their hard work and their dedication and partnership to move this to a scale approach or a state scale approach. So thanks again for being on here. I'm going to get to share a little bit of the exciting work we're doing in Ohio and how DYS gets to partner with our local jurisdictions to make this happen. Every time I start talking about Ohio and talk about assessment or resource centers, I like to share that for us, we look at this as the barrier to the juvenile justice system. So how do you take anything to any type of scale or approach, or how do you move an initiative forward? Well, you have to have some funds to make that happen. So I want to talk a little bit about how at the Department of Youth Services through our Bureau of Community Reinvestment, how our funding initiative works and how we are establishing and maintaining assessment and resource centers throughout Ohio. We have a very basic system of funding. We would call the first portion of that, or our base level funding, the Youth Services Grant, which is a census-based grant that is like the cornerstone to what we do in Ohio. All 88 counties receive this grant. Then we also have the Reclaim Ohio grant, which is our formula-based grant. And I could go into some more detail with that, but I'll save that for another conversation. But those two are the core funding that our local juvenile court partners receive each year. We also have some other categories that kind of really play into what we do with building out community-based options, but we have our targeted reclaim initiative that started back in 2010. This was one of those key initiatives that kind of led the way to community-based treatment and options for youth. And then we have our behavioral health and juvenile justice initiative that's also funded through the department that kind of all links together when we talk about these services and interventions. We also have our juvenile detention alternative initiative that launched back in 2010. This is also a key initiative for us as we develop these array of services and interventions. So today I want to talk to you mainly about our competitive reclaim funding. It's exactly how it sounds. It's competitive. All 88 juvenile courts can apply. By code, the Department of Youth Services funds local juvenile courts. And so competitive gives us an opportunity to create some different categories of funding. It's designed to divert appropriate youth from further penetration into the juvenile justice system and reduce the need for out-of-home placement. We also want to reduce the need for costly large congregate care and any type of residential placement if at all possible. So this includes any type of out-of-home placement. So when we talk about competitive, our main focus is community-based and reducing out-of-home placement. This supports development and research for the most effective services in addressing the needs of multi-system youth and families. Through this project, we try to build a statistical sample that allows us to analyze the most cost-effective ways to do this work and also the outcomes that our youth and families are receiving. So our first official competitive reclaim funding was awarded in 2015. The interesting part of that, our first category was internal court diversion. So we've been focused on diversions for quite some time here in Ohio. Our other option was community-based in-home treatment, where we really focused on a multi-county approach and really looked at home-based treatment like MST and things like that. So as we have evolved in competitive reclaim, I'll talk a little bit about some of the other categories we've had over the years, but I'm going to focus on one that we've really tried to cement into what we're doing through competitive reclaim, and that's our Resource and Assessment Center awards. This is 2 years of grant funding that is awarded to local juvenile courts. It's intended to stand up their assessment and resource centers. They're limited to $175,000 per year. And courts can request additional funding if needed. But this is like the startup funds that we give courts to kind of stand this process up. This is where the partnership with the NAC and other partnerships throughout our Ohio network that have allowed us to really grow and evolve all the resource centers in Ohio. When possible, we try to at times give a third year of funding. So we've been fortunate to be able to do that. And you heard Carly talk a lot about that, but one of our goals, sorry, Josh, next slide. And our vision for resource centers is to create a community-based single point of contact where youth and families can go in their neighborhoods. They can go into a church or they can go into a community location and get services and link to their basic needs. So we can make sure that they don't need a referral from a court, but they can go in at a community-based location to get some of these things that we can get every single day. Again, we want to maintain and make sure we are diverting kids from that formal processing at the juvenile court. It's one of our keys in all of our diversion efforts in Ohio is to continue to expand resource and assessment centers. So the purpose, I just talked a little bit about that. But locations, when we started to develop these, a lot of places wanted to use unused detention space. Through our Juvenile Detention Alternatives Initiative, we had many sites that had space and they're like, hey, we'd like to use our detention center. Well, our focus was in a community-based location. As you could see, some of those locations are residential options. Some of the sites on the previous slide had houses. That's what we encouraged: homes in neighborhoods, old schools, different community spaces where kids had public transportation or court-provided transportation to get to these sites. So, and then I'll talk a little more about the activities and some of the best practices that we have done over the years. But this initiative, sorry, if you want to go back, Josh, just want to talk a little bit about this. This all started for us too. I mentioned JDAI. Some of our early adopters of resource and assessment centers started as an alternative to detention. We started utilizing detention screening instruments and wanted to make sure that we were making objective decisions in where kids were going. So we had a very early adopter of assessment resource centers in Montgomery County. They actually built it into their Juvenile Justice Center back in 1997. And then Lucas County, Franklin County, and Ashtabula County were our early adopters, where Lucas and Franklin County created these specifically for alternatives to detention. Then Ashtabula kind of led the way for us, and many of you are familiar with some of the work they're doing, but they actually closed their juvenile detention center and created a community-based hub where all their resource and assessment center activities kind of occurred. So screening, assessment, and if a youth needed some type of out-of-home placement, they contracted and partnered with other counties in Ohio. Our big push has been in the last 6 years, as you can tell. In 2019 and 2021, we onboarded several counties here. Most all of our major metro counties have a resource or assessment center, and they look drastically different from place to place. And I'll just talk a little bit more about that later on. Next slide. So here are the 23 resource and assessment centers in Ohio. We are a home rule state, so many of you might be in the same boat, but all of our programs and interventions are locally run. So you can see that we have them spread out throughout Ohio, and each one's a little bit different. I like to talk about Fairfield County as they started. How they start is never how they finish, but they started in just a small little room on the second floor right by the police department, thinking that was going to be where the majority of the referrals were going to come from and how they were going to intervene with kids in the earliest parts of their juvenile justice involvement. Well, fast forward COVID, that changed everything for how we responded to situations and how they responded to situations. It's transpired into a community-based location where they share space, where they have their evening activities, where they have a food pantry, where they have church services and programs that are led by another organization in the community. So they just have evolved over the years, but everyone is different, and we encourage that. These resource and assessment centers follow the NAC framework, but they need to meet the needs of each community, and each community is different. Next. So from the state perspective, we are constantly trying to maintain levels of funding. So we have certain data reporting expectations for each of the programs. We definitely want to disaggregate all of our data for youth that are served, the offense level. We want minimal screening and assessment at minimum. We want certain dates and interventions and times when these things are taking place. And the most important thing for us is to see whether or not completion was successful or unsuccessful, or there's a neutral reason why a youth didn't complete a program. And again, we're looking at most of these programs are 12 months post-program completion. We're looking at new offenses that would have occurred prior to their termination. So we want data to drive our decision-making. One of our big fears early on was we didn't want to net widen. We don't want to involve more kids in formal system involvement. So we wanted to make sure we were tracking these youth appropriately. So I mentioned some of these, but being locally run, there's so many different services that are provided. I was visiting one in the summer, and they had their school food lunch program was providing meals to kids in the community. We have family navigation, life skills training, crisis intervention, pediatric care. One of our centers was doing eye exams and some of those other things. A lot of centers, all their diversion efforts roll through the resource and assessment centers. So there are so many different things that can happen here. Again, for us, it becomes a single point of contact to then link people to the community. How can we better serve families and meet them where they're at through these interventions? So here are some of the outcomes. This is for most programs, 12 months post-program completion. We were looking at about 4,219 youth that could be measured in fiscal year 24. 80% of these youth achieve their primary outcomes. Each site identifies an individual outcome, but they're very consistent. But we want people to be able to tailor their specific needs of their community to their outcomes. But most of those are in one of the primary things we look at is no involvement in the juvenile justice system or no adjudication. So what we envision for what's next, we've had several committees and different things that have taken place over the last several years. We want to continue to promote and expand resource and assessment centers into different counties, but we also want to look at how we can expand them into multiple locations, into single jurisdictions. In our larger counties, there could be a need for more than one. So we want to see how we can actually expand those more. We want to increase our collaboration with other state partners. We've really worked hard in Ohio to work with the Department of Medicaid and Ohio RISE to share and link services. We encourage participants through application to include community partners and system partners to share space and provide families with the resources that are needed. We would love to see centers that are community run and court supported. We actually have one of our 23 that's exactly how it is operated. And we want to continue to enhance our data collection and reporting through the ACORN data collection system with the NAC. All right. I know I said a lot in a short period of time, so appreciate the opportunity.
Thank you, Corey, and thank you, Carly. Couple of questions from folks in the chat, and a number of them, unsurprisingly, are about kind of more operational questions about what assessment centers really look like in practice, how much they cost. So maybe, Carly, starting with you, from your perspective, is there like a core kind of staffing model or like a minimum set of staffing requirements or other kind of program components that you recommend that have to be in place to have a well-functioning assessment center?
I think this is going to be an answer that's not going to make anyone happy, but the answer is no. Because assessment centers are really driven by community need and really focused on, again, where is their opportunity to serve as that hub. So assessment centers can look very different in different communities. Again, in some communities, they really do have that bricks and mortar function where youth go to an assessment center and the services are provided there. That would have more of a traditional staffing model. In other communities, I know there's a question around what these look like in rural communities. I would also say there are assessment centers in frontier counties. And if you think about what a model would look like there, it's going to be very different. You're talking about co-location, you're talking about potentially mobile, like an assessment center really being structured as a mobile service. So they look very different and are very much grounded in what the community looks like, what the needs are in the community, and where there's opportunity to facilitate collaboration among all of the system stakeholders to achieve the goal.
One other related question for turning to Corey, which is one of the questions in the chat was around basically our assessment centers residential. And I imagine some of the challenges maybe with having a flexible model is that language can get confusing because sometimes folks in the juvenile justice system think of observation and assessment centers as like residential places that kids go and get like a assessment prior to disposition. So can you talk about, do some assessment centers have like a respite or other kind of residential component to them, or are they purely community-based?
So for us, one of the requirements of competitive reclaim is they're non-residential programs. So they have to be community-based. With that said, is there an opportunity for respite, especially for short periods of time? We actually have one assessment center that was the building that they were able to utilize is an old sleep study building. So they created some rooms in that building that are like safe spaces and have places where kids can be for periods of time, maybe if they're waiting overnight for someone. But the majority of these are non-residential options. They're there for brief periods. Many of them don't operate 24 hours around the clock based on need. One of the things that really for us, we learned early when we first started this conversation, Corey, I need 24-hour staffing. I'm going to need this. I'm going to need this. I'm going to need this. Well, we looked at the data and they realized this is when we need to be open. This is when the majority of our referrals come in. This is when walk-ins will come in. One example is Sunday evenings are busy. You know, a lot of DV calls on Sundays as families are preparing for the week and different things happen. And it's really depends on the local jurisdiction too, but they are non-residential.
Really, any additional thoughts on that question?
No.
I would only add, I think it obviously makes sense for assessment centers to be community-based, but part of that multi-system collaborative stakeholder approach should be options for things like crisis respite. Too often we see in many juvenile justice systems, actually one of the top reasons for kids becoming involved in the system is like domestic conflict issues, and the police are called, and there's not a lot of other options. And so the ability to complement crisis respite, shelter, other kinds of mediation supports with assessment centers so that you can then get that more in-depth assessment and connection with services, all without ever going into any kind of longer-term placement or becoming involved in the juvenile justice system, can be really helpful. I know, Carly, you mentioned this a little bit, but folks had asked about rural communities, and that's often a question that we get asked around, there's no multi-system collaboration because there are just no services, period. Maybe Carly, starting with you, and then hearing from Corey about his experience, like, so what does asset mapping look like in a more rural community? How do you solve for transportation barriers? Just what does kind of an assessment center best practices model look a little bit more like in a rural area?
So it really is leveraging what is available in the community and then thinking about how to connect youth and families to those services, potentially through telemedicine or other kind of creative ways of accessing those services. So again, it really depends on the state and the community. In some states, some assessment centers have access to funds that can really offset transportation costs or kind of really support youth and families with accessing certain, certain services, certain resources that would otherwise be unavailable, whether it's for transportation, it's an insurance or kind of other cost issue, or maybe it's a county over, assessment centers can kind of navigate some of those barriers. But I know in particular for example, the frontier county that I'm thinking of, they've really leveraged, access to services through telemedicine and been able to really support building capacity through that mechanism.
Corey, any lessons learned here from Ohio?
Yeah, one of the things we realized early with programming and all of our programs we fund are that if kids can't get there, they can't complete successfully and they can't have good outcomes. So we fund transportation for local jurisdictions so they can create a transportation program where they can get kids to and from those places, which can be really helpful. We've even worked at the state level with Uber for certain things for some of our kids, and are continuing to try to find other ways because there's not public transportation. So without a court transportation program, some of these things don't exist. So that's really important for us, is to allow courts to utilize funding to make that happen.
Corey, another question starting with you is, and we often see challenges around this in jurisdictions, is wanting to do a lot more early intervention and diversion, but then data collection becomes really hard, and there can be sort of concerns about quote unquote tracking kids when they're not formally in the system, but also a desire to really evaluate whether diversion initiatives are working. Can you talk a little bit about how the assessment centers have been able to collect data, and has there anything the state has done to help support that?
Yeah, with all programs that are funded through our reclaim and subsidy grant, there are certain program data collection requirements that anything that is being funded we track. We partner with the NAC on the ACORN initiative to really get a detailed accounting of what's happening. So it's in a pilot phase for us now. So we had a base level of data, and we had some courts participate early that were really collecting a lot of the data, but not quite all of it with a level of detail. So one of the ways that we help courts in collecting data is we identify like those that are in a behavior change program that we want to track 12 months post-program completion, or an example for a kid who's just being referred to service, like a parent comes in, they need just real brief linkage, right? Like that might just be counted that youth was served. So we wouldn't collect demographic information. We just track that youth who showed up. We would track demographic, but we wouldn't track name or anything like that. But those kids who need a higher level of care, then we would use the NAC framework to help track that. So we would look at charge, we look at a number of different things that way. And we really work with the courts on each program to define successful completion and their outcome measures, so we know what they're looking at, so it's clear.
Carly, any other insights on kind of data collection best practices?
Yeah, this is actually an area where we've been spending a lot of time over the last couple of years. Corey mentioned ACORN, which is the Assessment Center Outcome and Reporting Network, where we've developed a standardized set of measures to really evaluate referral pathways in. So how is an assessment center serving as that single point of contact? I know there's questions in here around equity issues. We are collecting demographics. We're really trying to understand how youth are being referred to the assessment center, what are the charges, all of that. We're really looking at then what are the needs that are identified, so leveraging that screening and assessment data, and then also leveraging the case management data to really look at how are youth connecting to those community-based resources. So not just was the referral made, but did the youth and families really stay engaged with that service provider? Because all of these referral pathways in and kind of connection to the broader service or service systems are formalized through policy, through MOUs, there is the ability to then look at, as Corey mentioned, what happens a year out. Are these, young people coming back and being referred to the juvenile justice system? Are they escalating to the point of kind of adjudication or not? And also looking at re-referral to the assessment center. So this is a standardized way of looking not only across assessment centers in Ohio, but nationwide in terms of how they are serving as that single point of contact, what the needs are, and how effective are they at really connecting youth to services that mitigate re-referral to the juvenile justice or child welfare system.
Right. Well, we're almost out of time. I do want to ask Carly just to speak a little bit to if jurisdictions are interested in assessment centers, how they can get help. But just one quick point about some of the questions again in the chat around assessment centers having a moment, which I agree and I think is great. But really want to encourage that multi-system collaboration approach, because other service systems do have maybe not the exact same model, but someone mentioned the chat. Child welfare system has been funding family resource centers. The behavioral health system, there's a real movement around certified community behavioral health clinics, CCBHCs. So it's important to really bring all of these stakeholders together, because what we see in a lot of jurisdictions is that there are multiple doors for youth and families to get services, but no necessarily right door or coordinated door. And often youth and families don't really know about those approaches. And so the hope is part of really an effective you know, as Carly said, whatever you call it, center really is a point of all of those systems coming together and coordinating around a centralized approach to assessment and referral. So just to end, Carly, if folks have questions or are interested in developing an assessment center, where should they go? How should they start?
Yeah, I would just encourage you to find us online, the National Assessment Center Association. You can email myself or our executive director, Molly. And there's so many wonderful questions in here that I know we would love to have the opportunity to talk more about.
Thank you, Carly. Thank you so much, Corey. Appreciate everyone's time. The recording will be available and sent out to folks in the next couple days. So thank you all for joining and happy Halloween.
Thank you.